Hello, my name is Yasuhiro Maejima from TMDU. Today, I'd like to talk about the beneficial effects of factor Xa inhibition for preventing atherosclerosis. The major function of factor Xa is to promote blood coagulation. On the other hand, factor Xa also activates intracellular signaling through activating protease-activated receptor 2, hereafter PAR2. Previous studies demonstrated that factor Xa promotes atherogenesis by activating PAR2-mediated signaling. Also, it has been shown that PAR2 is essential in the progression of atherosclerosis in ApoE knockout mice. In addition, previous investigations have shown that macrophage autophagy plays a protective role in atherosclerosis. However, it remains unknown whether there is a molecular link between factor Xa PAR2 signaling and autophagy machinery. To examine the mechanism whereby factor Xa exacerbates atherosclerosis progression, we initially evaluate the effect of Rivaroxaban, a direct factor Xa inhibitor, on an experimental atherosclerosis model. In ApoE knockout mice fed with a high-fat diet, administration of Rivaroxaban significantly reduced the atherosclerotic areas. We next examined the effect of factor Xa in murine macrophage cell lines. Treatment with factor Xa significantly enhanced mTOR activity, thereby suppressing autophagy machinery through PAR2-mediated signaling. Conversely, Rivaroxaban promoted autophagy activity by inhibiting PAR2-mediated mTOR activation. Treatment with the pro-atherosclerotic agent promotes NLRP3 inflammasome activation, thereby enhancing IL-1 beta production from macrophages, which in turn facilitated the formation of atherosclerosis. A previous report demonstrated that inflammasome is degraded by TRIM20-mediated precision autophagy. We also found that inflammasome is degraded by autophagy in macrophages, which results in the reduction of atherosclerotic progression. On the other hand, treatment with factor Xa significantly enhanced mTOR activity, thereby suppressing activity of precision autophagy, which results in the progression of atherosclerosis. Treatment with Rivaroxaban significantly reduced mTOR activity, thereby suppressing inflammasome activity in the precision autophagy-dependent manner. In summary, factor Xa PAR2 signaling promotes atherogenesis by accelerating inflammasome activities through the suppression of macrophage autophagy. Here, I would like to show the significance of this study. Previous large clinical trials demonstrated that the administration of Rivaroxaban could reduce the occurrence of major vascular events in patients with coronary artery diseases. Our current study is one of the reverse translational researches for the exploration of the underlying mechanism of the results of previous randomized controlled trials. As a result, we could reveal part of the molecular mechanisms as to how factor Xa worsens atherosclerosis diseases. We hope our current result will be useful in the clinical application of Rivaroxaban as an anti-atherosclerotic drug. Thank you for watching.